Today's Spotlight is brought to you in part by presenting sponsor, Busey Bank. Busey, your dream, our promise. You're watching Spotlight, and today I'm joined by Kara Murphy and Dr. Lanny Wilson from the DuPage Health Coalition. So welcome.
Thanks so much for having us.
It's great to have you here, and we're looking forward to learning a little bit more about this coalition.
Happy to share.
Yeah. So Kara, I'm going to start right off with you. Okay. You've been around for 18 years, so give us a little bit of that history.
Sure. So it's hard to remember back to 2001, 2002, but here in DuPage County, what we were finding was that the demographics of the community were changing. We had thousands of patients who were living here in Naperville and the rest of DuPage that didn't have access to health care and who didn't have a lot of money to be able to pay out of pocket. And so what we really thought was we had an opportunity as a community to come together across the entire county and build a model that really helped everyone who was low income be able to get access to excellent health care. Since 2002, we've served about 55,000 patients in the Access DuPage program, and it's really based on the volunteer efforts of every hospital in DuPage County and thousands of physicians. We connect people, get them enrolled, and then really provide pretty comprehensive health services for about $1 a day per patient.
And that's incredible.
Because, that's because every dollar that we pay is matched by $10 worth of donated services. So it's really our medical community that makes that possible. And we've been doing it for a long time, and we've had partners that have been with us, like Dr. Wilson, since the very, very beginning of the program.
Well, that's amazing. I find that fascinating, and I know we're going to talk a little bit more about the programs, but I'm going to ask you, Dr. Wilson, that sounds like a very collaborative effort and a culture that really is trying to connect people. It sounds like people who need healthcare, but also the different healthcare systems themselves. Tell us a little bit more about that.
When Kara's predecessor, Dick Endress, first used this word, culture of collaboration, it changed my world. You know, when people work together collaboratively, things happen. You take a drop of water by itself, it's powerless. You take a whole bunch of drops of water together to make an ocean, it's one of the most powerful forces in the world. So we have this culture of collaboration, which includes, as Kara said, the hospitals, physicians, the health department is a tremendous partner. We have about 30 different partners who have worked together with this culture of collaboration to do the great work that we're doing.
Yeah, that's really with the patient front and center, obviously. Absolutely. There, right?
That's right. Yeah, that's the patient is. That's our goal, is to provide the very best health care in the world. You know, I think everybody on our DuPage Health Coalition feels that health care should be a right of every person, not a privilege for those who can afford it.
Yeah.
So we are trying to deliver the same quality health care no matter whether you have no money or whether you have all the money in the world.
Well, and what I like about that is that you're talking about, you identified that need, you came together to try to service that need right here at home. And I think, you know, that is so important of figuring out a way to do it. It can't always get done on the national level, but you figured out a way to do it right here in DuPage County.
You figure that DuPage County is one of the wealthiest counties in the whole country, and yet there's a growing number of folks here in DuPage County who can't get access to health care.
Yeah, and that's frightening, right?
Sure is.
Yeah, absolutely. They talk about you're only one medical illness away from bankruptcy, and that's a scary thought for anybody, right?
I say that the truth is that no one can afford to be uninsured.
Yeah.
We take care of the most vulnerable individuals, but any one of us, if we found ourselves without access to insurance, would very, very quickly run through all of the resources that we have.
Yeah.
But these are folks who, on average, are making incomes as an individual well under $20,000 a year. A family of four may be living off of $35,000 to $40,000 a year. They can't meaningfully pay for the true cost of health care without some resources. And we have great assets. We have fantastic physicians. We have fantastic hospitals, the highest quality health care in the country right here in our backyard. And folks, when offered the opportunity to participate, have really been resounding in their willingness to do so.
That's great. And it's so nice to hear that, right? Yeah. It really is. It means a lot.
Absolutely.
Kara, talk a little bit, you know, you've kind of talked about the history and the culture, but talk a little bit specifically about some of the programs that you offer.
Sure. So we've talked a little bit about the Access DuPage program, and that's really coordinated health access for people who don't have any insurance. But we have two other programs that are also good resources for people, and they may not know about them. One is a program called Silver Access. And Silver Access is actually a program that helps people to purchase the insurance they qualify for on the ACA marketplace. There's all this jargon around healthcare. People don't understand it. But the important thing to understand is that there are some people that now qualify for health insurance through the Affordable Care Act, but because their incomes are so low, they have a really hard time purchasing the insurance they qualify for. So we help to make it just a little bit easier for them to purchase those high quality plans and be able to be insured just like you and me. The third program that we offer that's really new just in the last year or so is a program called the Dispensary of Hope. And it's located in Wheaton, but just up the street from Naperville. And it's a free pharmacy for any low-income DuPage County residents who don't have insurance and need to be able to get the chronic medications that they're counting on to stay healthy. About 83% of our patients are working in one or more jobs outside the home. These are the working poor, but they don't qualify for health insurance. And so to be able to offer them about 200 different generic medications that help people to treat their diabetes or their asthma or their heart disease so that they're able to keep going to work, able to keep caring for their families. That's really what we're here for. And that's our newest program.
And those pharmaceutical costs sometimes are a lot more expensive than seeing a physician or even going to the hospital.
Absolutely. And there's no doubt about that.
Absolutely.
I mean, I think even when you have the health insurance, you're sometimes a little bit mortified at what some of those prescriptions are going to cost you. And you hate to be in a situation where you're not giving your child a medication because you can't afford to. And you know that it would solve the problem. You know that it would help them be healthier or take care of something that's important.
Those chronic medications are what keep you healthy. And if you lose access to them, then your health can deteriorate very, very quickly.
Absolutely.
So we're trying to make sure that we're addressing things in the most proactive way possible.
Yeah, fill that void.
Yeah.
Dr. White, you're on the board here. What keeps you engaged with this work?
Well, I get to work with nice folks like Kara, for one thing. But you should see the people on the board that we work with. They're some of the most caring people in all the world. I think Dr. Albert Schweitzer said, "Those who will truly be happy in life will have sought and found a way to help other folks." So every person on our board is there generously trying to make the world a better place, trying to make the world a healthier place. So I think it's the people that I work with, plus our mission to provide health care of the same quality for these working poor or very poor who can't be employed, the same quality health care across the continuum of health care.
Certainly a mission you can get behind and get up in the morning for, right?
Yes, ma'am. I love it.
I can sense that. Kara, as we wrap up, say a little bit about the families that you serve. You want to give us an example, perhaps?
Sure. Well, I mean, what I'd say is that the average person that we're taking care of is in their early 40s. That means they're probably a mom or a dad. They're caring for themselves as well as their family. They're living here in Naperville and in all of the other communities around it. And they're probably your next door neighbor, or they're the person that's serving you at the grocery store, or perhaps the waitress that served you coffee this morning. You don't know who's uninsured. You don't know who's struggling. But recognize that we're surrounded by both resources and challenges. And this is just one local effort to try to make it just a little bit easier for folks.
Well, I think, obviously, I'm so excited to have heard more about what you're offering up. It certainly sounds like there's a tremendous commitment and that culture of collaboration, which is so important to getting these kinds of things off the ground. And thank you for the work that you're doing right here in Naperville. So much appreciated.
Yeah.
If you would like to learn more about the DuPage Health Coalition, please go and visit their website. We're going to take a quick break, but stay with us. We're coming right back with more Spotlight.